Welcome to our Obstetric Gynecology educational video. Today we'll review 10 important clinical questions. After each question, we'll pause for 5 seconds to give you time to think about your answer. Let's start with our first question about postpartum care. A postpartum nurse is caring for a client who delivered a viable newborn infant 2 hours ago. The nurse palpates the fundus and notes the character of the lochia. Which characteristic of the lochia would the nurse expect to note at this time? A. Pink-colored lochia. B. White-colored lochia. C. Serosanguineous lochia. D. Dark red-colored lochia.
The correct answer is B. The OGTT is a screening tool for gestational diabetes, and further testing is needed to confirm the diagnosis. A value of 163 milligrams per deciliter on a 1-hour OGTT is above the normal threshold, typically 140 milligrams per deciliter, so the next step is to perform a 3-hour OGTT for confirmation.
Question 3. A client in the 3rd trimester of pregnancy arrives at the physician's office and tells the nurse that she frequently has a backache. Which instruction would the nurse provide to the client to alleviate the backache? A. Sleep in a supine position on a firm mattress. B. Eat small meals frequently. C. Use good posture and body mechanics. D. This option appears to be missing in the original question.
The correct answer is C. Use good posture and body mechanics. Good body mechanics and proper posture help distribute weight properly and reduce strain on the back. Sleeping in a supine position, option A, is actually contraindicated in late pregnancy as it can compress the vena cava.
Question 4. A prenatal client with a history of heart disease has been instructed on care at home. Which of the following statements, if made by the client, would indicate that the client understands her needs? A. There is no restriction on people who visit me. B. I should avoid stressful situations. C. My weight gain is not important. D. I should rest by lying on my back. Question 5. A student is conducting a clinical conference about the hormones related to pregnancy. The instructor asks about the function of progesterone. Which response indicates an understanding of this hormone? A. It softens the muscles and joints of the pelvis. B. It is the primary hormone of milk production. C. It increases during pregnancy to stimulate the basal metabolic rate. Or D. It maintains the uterine lining for implantation and relaxes smooth muscle, including the uterus.
The correct answer is D. Progesterone maintains the uterine lining for implantation and relaxes smooth muscle, including the uterus. Option A describes the effect of relaxin, option B describes prolactin, and option C describes thyroid hormones.
Question 7. A nurse is caring for a client in active labor. Effective, natural, soothing techniques that the nurse plans to use during active labor to assist the client include A. Isolation and distraction. B. Counterpressure and effleurage. C. Pharmacological interventions. Or D. Panting and pushing.
The correct answer is B. Counterpressure and effleurage. Effective natural soothing techniques that include counterpressure and effleurage can help alleviate discomfort during active labor. Isolation may not be appropriate. Pharmacological interventions are not natural soothing techniques, and panting and pushing are proper expectations, not necessarily soothing techniques. The correct answer is B. Counterpressure and effleurage. These are non-pharmacological pain management techniques. Counterpressure involves applying firm pressure to the sacrum to relieve back pain, while effleurage is light massage of the abdomen to promote relaxation. Pharmacological interventions are not natural techniques, and panting and pushing are breathing techniques used during the second stage of labor.
Question 8. A nurse is caring for a woman experiencing a precipitate delivery with no help available. Until help arrives, the nurse places the client into which optimal position?
The correct answer is B. Semi-recumbent position. This position allows gravity to assist with the birth while giving the nurse better visualization and access to assist with the delivery. The knee-chest position would slow or stop labor, which is not appropriate for a precipitate delivery that is already happening.
Question 9. Butorphanol tartrate, Stadol, is prescribed for a woman in labor, and she asks about its purpose. Which response by the nurse is appropriate?
The correct answer is B. The medication provides pain relief during labor. Butorphanol tartrate, or Stadol, is an opioid analgesic that provides pain relief. It doesn't increase contractions, option A, prevent respiratory depression, option C, or primarily treat nausea and vomiting, option D.
Question 10. During a clinical conference, a nursing instructor asks a student to explain the purpose of effleurage for a client in early labor. Which statement